Well, thank you to the last three speakers. I must say that I'm challenged to summarize the day and reflect on it because there were so many themes. I wanted to start by acknowledging my co-chair, Chris Economos, and the other members of the Planning Committee, Rachel Nugent, Nancy Roman, who's still here, I think, Tim Lobstein, who was not here, and Shariki. This was a work of real passion for us all. The other thing that I wanted to say that I was so pleased by one of our efforts, as many of you know about with the roundtable, is the use of people first language. And I think today was an extraordinary success. There was the lack of that, that lack of usage was notably absent. So these are some observations. I hope they don't sound random. They may be disconnected because it was such a rich series of presentations that crossed a lot of really very interesting areas. In the first two talks, I don't know that you were struck by the slides that showed the curves of prevalence over time, but those were parallel for men and women and for developed and developing countries, which suggests that the exposure that caused obesity was across the population. There was no kind of birth cohort effect. And it's notable for what it doesn't show, not so much what it shows, because those changes were driven by a population-wide exposure to something or everything that changed everybody in the population. In the U.S., we've shown similar parallel curves for children and adolescents for different ethnic groups. So it was striking to see those data represented again. I was glad that we had treatment systems on the agenda. That's such an important area, and particularly since I think the health system is going to be the first to really be challenged by obesity, and more pertinently, the wave of diabetes that follows obesity. And as we saw in Mexico, that's already a huge problem. 10% of mortality is attributable to diabetes. Jim, I'm glad we had you on the schedule because I think you brought really good observational data and examples to what Fiona was talking about in the abstract. What I was struck by there was I think all of those examples were middle-income countries, not low-income countries. And I think the challenge, since some of those recommendations in the report come to changes in community infrastructure, how does one actually do that in a rapidly urbanizing, low-income country? How do you make the case that the transport, physical transport, bicycling, walking, should be preserved when, in fact, the development in those urbanized areas is often in the hands of developers who don't care about such things. They care about making and selling houses to the wealthier people. Another thing that we didn't talk about, which I think is an important theme we see here in children of Hispanic, newly arrived Hispanic populations, is the fact that obesity is valued. It's not considered a negative. It's what has enabled children in the developing world to survive the diarrhea that is so prevalent, and the solutions to infant mortality are one of the things that's driving down the undernutrition rates, or the potable water, the antibiotics, and so forth. So what's not to like about a child who has a little extra weight and who can survive one of those catastrophic challenges or infections? And that even among women, there are certain cultures which value women who at increased body weights, and even men who may tend to gain weight just to demonstrate that they don't have an HIV infection. That's actually been pretty well documented. Simone talked about the global megaforces, and I was thinking that the kind of globalization of the U.S. food supply is an important contributor to the epidemic. And we saw examples of the kind of oppositional characteristics or the oppositional response of the food industry to these efforts. And that raises some significant issues, I think, for us as a roundtable, because we've tried very hard to maintain relationships with the food industry. And we have a good example in the Partnership for a Healthier America, where commitments with industry to change to healthier products has actually worked. It hasn't yet, we haven't yet been able to demonstrate a decrease in the prevalence of obesity. But neither have the sugary drink taxes demonstrated a decrease in obesity. And I was glad that Nina pointed to policies as plural for this, because I think that we may see a partial decrease or a small decrease, and the modeling suggests that the decreases are small, but it's the beginning. It's the beginning of a variety of strategies. But as I've thought about this, one of the areas that I think is essential that we maintain as a roundtable is a sense of trust. That if we're going to make a difference with the food industry, we have to establish trust. And I think what I heard from Simone's presentation and Fabio's was that trust has been lost in many countries in Latin America. But the other striking thing about Latin America is how much progress has been made in terms of consumer demands or information, which is really extraordinary. But I think that as a roundtable, this issue of trust is something that we need to think about, because I don't think the same level of mistrust exists here as exists in Latin America, and it may be that the relationships with industry are different, or that that industry has been much more surreptitious in trying to affect the debate. I was really glad that Shariki and Harriet raised the issue of disparities and equity. I don't think, Shariki has been a persistent voice in talking about this, and I don't think that we've absorbed that lesson yet as a roundtable, and particularly the issues of both racism and classism, and the historic impact that displacement of indigenous populations has had on their ability to function, or the racism that has characterized the relationship with the black community. We've talked separately about adverse childhood experiences. These are adverse childhood experiences. They are expressed, I've just finished looking at some of the pediatric literature, and these adverse experiences are not expressed in terms of obesity in children and adolescents. It's in adulthood. And you'll remember the Felitti paper was the original description of the relationship of abuse and obesity, but that occurred in white women in Southern California, members of Kaiser Permanente. But the more general lesson is that we may not see that expression early on, but that could very well contribute to the kinds of differences that we see in adults, particularly, and we didn't hear very much about severe obesity in developing populations, but I suspect it's considerably less. But that's, I think unless we confront those inequities, which means addressing the disparities, which are a reflection of the inequities, we're not going to succeed in addressing the differences in the racial differences that occur, or the ethnic differences that occur with respect to obesity. And we cannot forget the historical trauma, which is now expressed in terms of individual racism or institutional racism or structural racism. You don't have to look any further than DC and across the river to know that those factors are operating here. And that resolution of the disparities is also resolution of the inequities. The diverse expression of obesity among migrants and different ethnic groups, I think, is what set up Shariki's why, and that's a question that I think we need to address. I think I have not absorbed, and despite the fact that Shariki shared that manuscript with me, I have not absorbed her latest framework. But as with every other of her frameworks, I think it's likely to provide some insights and answers that none of us would have previously had. So I'm looking forward to that. The final theme that I wanted to just mention in passing is relevant to the IPCC report on climate change. And several of us in the room are members of the Lancet Commission on Obesity, which has looked at the interrelationships of undernutrition, obesity, and climate change. And the discussion of sustainability is very pertinent here because the agricultural system that underlies the food system provides 29% of greenhouse gases, and meat consumption, or meat production, I should say, accounts for about 19% of greenhouse gases. So that changes in diet are likely to produce changes in global warming as a result of its impact on greenhouse gas production. And Jim's mention of transport is another one of those double duty solutions because gasoline, if people are in cars, they're burning gas, that's producing greenhouse gases, and it clearly contributes to obesity. We know there's a relationship between car use and obesity. So I wanted to end with those thoughts of sustainability, and particularly because Mira mentioned how the World Bank is starting an initiative on human capital in the next generation. But the Iroquois Confederacy, which was a series of about 6 tribes in New York, which controlled the northwest corner of the United States at the time that the Europeans arrived, was a very successful confederacy, and the way the Confederacy operated provided the basis for the U.S. Constitution. And they developed this concept of decision-making for 7 generations, for the 7th generation. And I think that's a useful thought to have as we think about the sustainability of the work that we do and the work that ties us up. How do we assure that our decisions are going to preserve the planet and planetary health and the health of the population for the 7th generation? So I'm going to close there and bring up, we have a panel, right?